Hello, my name is Jose Enrique Arauz, and I will talk about allocating organs to cognitive impaired patient. Definition: cognition is the ability we have to assign and process the data that comes from different ways. Cognition includes different cognitive processes, much as learning, attention, memory, language, reason, making decisions that are part of intellectual development and experience.
In this video, we're going to be talking about how to establish communication with a patient who may have cognitive impairments or maybe just hard of hearing. The first thing you want to do is make sure you read over the eval. By doing so, you want to establish whether the patient may only know things about themselves or outside the realm of themselves. If the patient only knows things about themselves, you might want to tailor your questions to things just about them. The way we're going to be doing this today is simply using yes or no questions. And this is to get some kind of accuracy in their responses back to you. Some examples of questions you could use is or are: is your name Janet Reno? If the person is Janet Reno. Is your shirt blue? Is your hair brown? You could also use questions outside of yes to get a no response. Even if their name is Janet Reno, you might want to say, is your name something else, to establish a no question. When doing so, and you get this accuracy in their responses back to you, one, you're increasing the efficiency. You're taking most of the guesswork out of your treatment. Two, you're building rapport. Just by them knowing that you just care enough to build this rapport, most likely the patient will participate more in your treatments.
Application in medicine. Ascent of a state of conscience using the Glasgow scale, vital signs, perfusion, ventilation, movement, and motor forms, superficial and deep sensitive, installing of organ monitor, nasogastric tube, bladder catheter, and venous light.
There's three ways to ask a question. The hardest is a free recall question. Do you remember what you were going to do in getting out of a chair? Now, the previous day we talked about getting out of a chair is done best by using the hands on the armrest. A free recall question, we're not going to give them any clues. Simply ask them, do you remember how we were going to get out of the chair now that you're having more problems doing so? Free recall, no cues. That's the hardest way to ask a question. There's an easier way to ask a question, cued recall. If they don't respond to that first question, they didn't have any good cues, we'll give them a little bit of a cue. It has something to do with your hands. They still don't respond, we could say, and where you were going to place them. So we just gave them a cue. And they're very likely going to recall what they were going to do at that point. Next, if they still don't remember what you did the last session or what you talked about the last session, you can give them a recognition question. It's like a multiple choice. Were you going to scoot forward, put your hands on the walker, or were you going to put your hands on the arm of the chair? And most people will be able to get it. If they knew it at the end of the session last time, they'll be able to get it this time. It's interesting. The ability to recognize the right answer of something that you've learned does not decrease appreciably with age. Well, let me say that again. This is an important little trick to put in your bag of tricks. The ability to recognize the right answer does not decrease with age. Your ability to do a multiple choice test, for example, does not decrease as much, nearly as much, as your ability to do an essay test. So if we give the older adults the alternatives, they often will have success. This is a very valuable technique when you're doing cognitive rehabilitation and kind of working on things like this. So many times when I'm doing cognitive rehab with a patient, I'll ask them a question, something I wanted them to remember. We're working on techniques to make new memories. They don't do the free recall, but I want success. So I'll give them the cued recall. Many times that's enough. But even if they don't have success there, we can go to a recognition question. It was the answer A, B, or C. And if they had laid the memory down earlier, they're likely to get it that way. Now let's look at the bottom left corner of this slide. Cognitive impairment, as measured by the mini mental state examination, had a correlation of 0.47 with rehab participation. Once again, square 0.47, you get 0.22, meaning that 22% of how much they participate in the rehabilitation process was predicted by their cognitive impairment. How much impairment did they have going into therapy? So those are the factors that I want to focus on. I want to focus on decreasing depressive symptoms and increasing cognitive abilities, particularly attention. In addition, we know that motivation would affect rehabilitation participation. We'll talk about increasing that as well. All of these factors together will give us a number of new tools to maximize the treatment efficacy for patients.
Pros and cons. Currently, advancing in neuroimaging allows use of psychological and neuroanatomic knowledge very important from the understanding and mental process and who these influence our behavior emotions.
Advantages of organ donation that you need to be aware of. In case of a deceased organ donor, the recipient may belong to a completely different religion or country. The donor has no right to choose who would get his or her organs. However, one has to accept the fact that life is equally precious for everyone. One of the most important negative impacts of organ donation, which is true in case of both living and deceased donors, is the unethical buying and selling of organs in the black market. It has spread worldwide, which is totally illegal. While most world religions support organ donation, there are some religions which strongly object to it, and still others which completely reject the idea. In case of a deceased donor, organ donation might have adverse psychological effects on the family of the donor. The thought of cremating him or her without the vital organs can be extremely disturbing and painful, psychologically.
Issue applicate in Ecuador. This has a great interesting information about the efficiency of cognitive training interventions to involve memory in elderly patients with a normal and middle cognitive impairment. All cognitive interventions between 1970 and 2007. Their amazing analysis to iterate efficacy. And conclusion, the results indicate that cognitive activation become an improvement and performation on the side of the effects from different kinds of memory scheme enabling elderly people and patients with mild cognitive knowledge.
Thanks to Skillshare for supporting this episode of SciShow. Organ transplantation is one of the coolest things to happen in medicine and is incredibly important for patients. The idea of taking a faulty body part out and replacing it with a healthy version has been around for centuries. But of course you can't just chop and sew organs without some understanding of science. So the road to the first successful transplant was full of challenges, discoveries, and a whole lot of work, especially related to tricking the recipient's immune system. As early as the 2nd century CE, you can find stories of leg, nose, and even heart transplants across the globe. From what we know of the technology and medical understanding of the time, the patients probably didn't have great outcomes. But that's just a guess. Historians don't have much concrete evidence because these early attempts weren't well documented. That changed in the late 16th century, though, with the Italian surgeon Gaspare Tagliacozzi. He performed skin grafts, taking skin from one area of the body and transplanting it onto another. And he got especially good at reconstructing noses. There were a lot more sword-fighting accidents back then, and I'll leave it at that. And as he developed his surgical skills, he made sure to document everything. In 1597, he published an illustrated book with a title that roughly translates to On the Surgery of Mutilation by Grafting. Besides showcasing his techniques, these records may have been some of the first to hint at the science behind skin graft rejection, when the recipient's immune system attacks the newly transplanted tissue. In particular, Tagliacozzi noticed that tissue from the patient's own body was generally rejected less than allografts, or tissue from other people's bodies. He attributed this to the force and power of individuality, which we now understand as individual immune systems. For the next few centuries, not much happened in the field of transplantation, but then 2 technologies set the stage for bigger breakthroughs. The first
Thank you.